Hello, and welcome to another episode of Healthy Perspectives. My name is Vernon Solomon. You've either used the expression or heard the expression before, an ounce of prevention is worth a pound of cure. That's the premise of our program this evening. Prevention as it pertains to the various diseases that we here in Antigua and Barbuda have to deal with on a routine basis. You know, here at AUA, we've put together a number of health fairs, and these health fairs on many occasions are designed for that very reason. What can be done to help prevent some of the diseases that we so often hear or see? However, we've gotten a lot of slack about our women here in Antigua and Barbuda. We've done our health fairs or our men's health days, so we have a special event coming up just for the ladies here in Antigua and Barbuda. It's our Women's Health Day. I had an opportunity to sit down with Dr. Andre Winter of the Winter Medical Center to speak about what some of the diseases are, some of the ailments that are affecting our women here in Antigua and Barbuda. Let's get his perspective on women's health here in Antigua and Barbuda. Hello and welcome back. At the outset, we mentioned that we'd be speaking about women's health, and we will in fact give you some additional information about our upcoming event. However, in the interim, we have with us today Dr. Andre Winter, and I'd like to get his perspective and insight on women's health here in Antigua and Barbuda, especially as it pertains to prevention. Dr. Winter, we've had this dialogue, you and I, on a number of occasions about women's health here in Antigua and Barbuda. Why do you think it's such an important topic, women's health? I know it's a very broad topic, but let's see if we can narrow it down a bit.
One of the, I think, important aspects of women's health has to do with the preventative side of women's health, particularly as it pertains to cervical cancer and also breast cancer, which happens to be the number one and number two leading causes of mortality worldwide. So particularly when we focus on the preventative aspects of healthcare, particularly with women's health, you're obviously reducing the overall impact on society when these individuals are no longer able to be productive members of our society.
But here's the interesting thing. We've been doing, and I say we, AUA has been doing a number of health fairs over the years. And generally speaking, it's the women that show up. And just to give you a little secret, when I started the Men's Health Day, we kept getting, why aren't you doing the Women's Health Day? Why aren't you doing a Women's Health Day? But I say that to say, the women generally show up to these events. So are they not, or have they not been doing what it takes, if you would, to see about themselves? Are they going for the wrong reasons? Has there been some misconceptions as to what the real problems are that are facing the women in our society?
I think generally they're aware of the issues or the problems that are out there, but many a times we find many excuses or other reasons why we do not look after ourselves. I'll give you the example of getting your car serviced on a regular basis, but yet still many of us do not look after our health with the same energy that we should.
Until the car breaks down, and then...
Exactly.
But then it's not the manufacturer's fault necessarily. No. So what are some of the things that we're saying that women should do then? I hate to put it this way, but routine maintenance. What are some of the things that they actually
with need to regards to general health maintenance for a woman? Probably number one on that list would be your annual pap smear. Any woman past the age of 21 should have as part of her annual physical exam a pap smear performed. The pap smear is one of the tests or tools that we currently have available in order to detect the early or what we consider precancerous changes that occur in the cervix before it becomes cancerous.
Okay.
Cervical cancer is actually one of the very, very few cancers that is preventable. Most cancers cannot be detected until they have fully developed. Cervical cancer, because of the precancerous changes that occur in these cells, a woman who affords herself of regular annual pap smear should these changes occur, we can actually detect them and treat them before they develop into cancer.
Okay. So now, for, let's say we have viewers that may not fully understand what a pap smear is. Can you explain exactly what it is, what's involved? Is it something that they should necessarily fear?
Sure. I think that's a very important point, Vernon. Probably the number one reason I get from my patients as to why they have not done a pap smear, it's going to hurt. Or a family member or a friend have told me it's going to be painful. First and foremost, the pap smear should not be painful. If you are feeling pain or discomfort, then you need to let your healthcare provider know this is uncomfortable.
Okay.
When we perform the pap smear, a speculum, which is a small instrument, is inserted into the vagina so that we can visualize the cervix. That's the opening or the mouth of the womb. There might be slight pressure from the speculum, but there should not be any pain whatsoever.
If a woman says that she is feeling pain, is it to say that there's a problem with her or the way the procedure is being done?
Could be both. If the procedure is not being performed properly, or if the woman is tense or anxious, that too could account for some of the pain that she's experiencing. But normally the pap smear should not be painful.
So the speculum's inserted, and then what's next?
Once the speculum is inserted, first you want to visualize the cervix. Does the cervix look normal? Is there any evidence of a discharge or other secretions within the vagina? Currently, most physicians, when they perform the pap smear, are using what's called a thin prep. Now, the thin prep involves using a liquid medium that we actually place the sample or the cells within that medium.
Okay.
The actual cells are collected using this brush. Now, there's actually two parts to the procedure. As you can see from the shape of the brush, the conical part of the brush collects the cells from the canal or the what's called the endocervix. The wider aspect of the brush collects the cells from the outside of the cervix. So when you're sampling the cervix, both aspects of it are collected at the same time. Once that is done, the collected cells are then placed in the liquid medium, and then this is sent off to the lab to be analyzed.
Okay. How long does this whole process take?
On average, you're looking anywhere between 2 to 3 weeks.
Okay.
From the time the pap smear is performed until when we get back the results.
The actual procedure, though, for collecting the cells?
Oh, the actual procedure itself, you're less than a minute.
So then, the fear then comes not so much the length of time, but the actual procedure. So we're telling our women of Antigua and Barbuda that this is literally going to take maybe a minute or less.
Exactly.
It's not taking much time out of their schedule.
No.
To then see about the rest of their life.
Exactly, exactly. And not only that, but as I mentioned initially, cervical cancer is a preventable illness. Reason being, we know what causes cervical cancer. Once the early changes can be detected, we can then treat it. So essentially, if every woman affords herself the opportunity to have a pap smear done, cervical cancer, maybe in my lifetime, your lifetime, should be a thing of the past because it can be prevented.
Because it can be. Woman has waited a little bit too long. What are some of the signs that she may very well then see to say, okay, you know what, I need to get to my healthcare provider and have this checked out?
Now, one of the issues with that, many a times in the early stages, there are no signs or symptoms. You might feel normal, you might look normal, but at the cellular level or the level of the cervix, certain changes are occurring within those cells. Many studies have now shown the actual causative agent that leads to these changes in the cells is a virus called the HPV virus, or the human papillomavirus. When a woman becomes infected with this virus will in turn cause certain cells to be abnormal. She will not notice those changes initially, and that is where the pap smear comes into play, because the pap smear will detect any early signs or abnormal changes that has occurred, which can eventually, if untreated, lead to cervical cancer.
All right. Dr. Winter, we have to take a quick break, but when we come back, I'd like to ask you, because it is a virus, how is it contracted? Okay, stay with us, we'll be right back. So thank you again for joining us. At the outset, we started our conversation with Dr. Andre Winter talking about women's health, but now we're on an interesting subject of HPV and cervical cancer. Now, you said HPV is in fact a virus.
That's correct.
How then does an individual contract this particular virus that may then lead to cancer?
Okay. First of all, let me elaborate. There are several types of the HPV virus. Now, the HPV virus that we're most concerned about are those that lead to either cervical cancer, vaginal cancer, vulvar cancer, or genital warts. And these viruses are primarily transmitted sexually.
Okay.
In other words, through sexual contact. So if you have sexual intercourse with an infected individual who has the virus, then that virus can be transmitted to you.
Okay.
Now, not all individuals who contract the virus will develop these cancers or the warts. It is dependent on the state of your immune system. Some individuals, if their immune system is able to clear the virus, then they would not see the effects of the virus.
Okay.
But we have no way of checking or establishing the status of your immune system.
Is there then a way that a person can boost their immune system to ensure that if they do come in contact with this virus, that it then is allayed or warded off?
They can boost their immune system, but at the same time, each and every time you're exposed to the virus presents a new challenge to your immune system. So you might be able to dispel the virus initially the first or second time around, but not necessarily the third, fourth, or fifth exposure.
Best way then for an individual to protect themselves is?
Best way basically to know both your status, your partner's status, and also most recently through the advent of the HPV vaccine. With this particular vaccine, which is primarily targeting the young adolescents, in other words, before they become sexually active or before they're exposed to the virus, to administer the vaccine and thus prevent them from being infected by the virus and hopefully preventing the development of either genital warts and or cervical, vaginal, or vulvar cancers.
So, first of all, what's this vaccine called?
The vaccine is called Gardasil,
Okay.
which actually prevents, actually targets primarily 4 types of the HPV virus. The HPV 6 and 11, which primarily causes genital warts, and 16 and 18, which primarily leads to cervical carcinoma.
Okay. So now, with this vaccine, are we then saying, or do we then run the risk of people saying, oh, well, you're trying to promote promiscuity by giving my young adolescent this vaccine, knowing that it is a vaccine that's trying to ward off something that's contracted sexually?
Far from it. I don't believe it's promoting promiscuity in any shape or form. One still needs to practice safe sex. The vaccine only protects against HPV virus. There are other STDs out there in terms of HIV, gonorrhea, chlamydia, syphilis. The vaccine does not protect against those. So one still needs to practice safe sex.
Responsible sex. Is it then, I recognize that we're talking about women's health, but is this something, this vaccine in particular, that's only for females?
No, the vaccine is also, also recommended for adolescent males as well. Because if a woman has sex with an infected male partner, she can contract the virus in that manner. Therefore, a lot of research has shown that if you also provide the vaccine to the young men, hence preventing them from being infected with the virus, you can subsequently also prevent the spread of the virus to their female partners.
From your research in this vaccine, what has been the response, whether it be locally or universally, to this vaccine? Do you find that people are really jumping on board with it, or is there any hesitation?
Many people are asking questions about the vaccine. They're seeing the benefits of the vaccine. I think there's still a lot of misunderstanding concerning the vaccine, and hopefully through this program and also through the Women's Health Program, we'll be able to answer a lot of those questions and also provide information concerning the effectiveness of the vaccine, who are the eligible participants for the vaccine, and exactly how the vaccine works. So hopefully through education, we're then able to instruct and also to pass on the knowledge to our patients in this manner.
Is it something that's readily available here in Antigua and Barbuda?
It is available in Antigua and Barbuda, yes, that's correct.
And the information that's being disseminated, where, yes, at the Women's Health Day, we will definitely be able to, but are there locations now where individuals can go and receive further information, or just go primarily to your healthcare? Yeah,
primarily to your healthcare provider, whether it be your district clinic or your private physician. This information can be given to you.
Okay. Now, we've touched on the issue of HPV as well as cervical cancer, but there's still another issue that we need to address, and that's breast cancer. Now, we need to take another quick break before I get in trouble again. But which one is number 1 and 2, cervical cancer or breast cancer?
No, breast cancer is still number 1. Cervical cancer is number 2 worldwide.
Okay.
Yes.
So we're going to talk about breast cancer when we come back. Please stay with us. We'll be right back. Welcome back, and if you're just joining us, we're still talking with Dr. Andre Winter about our upcoming Women's Health Day. But before the break, I mentioned to you breast cancer, and I bring up breast cancer in part because, as you mentioned, it's the number 1
That's correct.
killer worldwide. Can you, again, dispel some of the fears that women may have with regards going to have themselves checked for breast cancer, or we're talking about prevention, so what are some of the preventative measures that they need to take?
With regards to breast cancer, as I said, which is the number 1 killer worldwide for women, one of the points I hear very often when I ask my patients, do you do your self-breast exam on a regular basis? Many times the answer is no. I'll ask, why not? I don't want to feel anything, which is not the approach we should be taking towards breast cancer. Many times, most of the lumps or masses are actually picked up by the patient herself. So if you're doing regular breast exam, should there be any changes within the breast tissue, you'll be aware of it, and then it can be fully evaluated. Once you detect a mass, then you should go to your healthcare provider in order to determine what exactly the mass is. Is it a cyst, or is it a lesion, whether it be benign or cancerous? he or she may then send you to have a mammogram done in order to provide more information concerning what exactly is this lesion. Now, many times, that's the other issue women have concerning getting a mammogram done. Oh, it's going to be painful. I don't like the pain involved in it. Do I really have to do a mammogram? And the answer is yes.
When?
Now, there's been several articles, several controversies concerning when that woman should afford herself of that initial mammogram. Basically, that should be done at age 40, unless there's a significant family history that would dictate the mammogram to be performed at an earlier stage,
Okay.
or an earlier age. But definitely, once the woman is past the age of 40, she should be availing herself of an annual mammogram every single year, without exception.
Expensive?
Not expensive. The mammograms are available free of charge at the Mount St. John's Hospital. They can also be attained privately as well.
We're talking about findings, and I don't think this is something I asked you about when we were talking about cervical cancer and HPV. When a woman, when there are these changes noted in their pap smear, what's the next thing that they should be doing?
Now, that's a good question. It all depends on what changes are noted on the pap smear. When we get back a pap smear result, it can be in several categories. Either the pap smear comes back as normal, that being the case, everything is fine, we'll see you back next year, same time. If the pap smear comes back showing a precancerous lesion, that is different to if the pap smear shows that you have a cancerous lesion. If it's a precancerous lesion, is it a low-grade lesion or a high-grade lesion? In other words, these are changes within the cervix that has occurred before that lesion progresses to cancer. In other words, it's a precancerous lesion. Once a precancerous lesion is detected, it can be treated before it becomes cancerous. That is actually one of the benefits of having regular pap smears done.
Because that's what I was going to ask you. Is it, excuse me, at that phase that, is it a death sentence now?
Far from it, far from it. Definitely not a death sentence. Many women become anxious, obviously, once they learn that their pap smear is abnormal. But if it's a precancerous lesion, in other words, that individual does not have cancer, if left untreated, it might progress to cancer. But once it's treated adequately, that woman or that lesion would not have progressed to cervical cancer.
So let's say cancer is found, and now treatment needs to begin. What are the treatment options? And again, is it to say that because it's cancer, there's no hope, all is lost now?
And again, far from it. With regards to once a diagnosis of cervical cancer is made, several treatment options are available. Now, these treatment options tend to be used in unison. In terms of the surgical aspect of it, this woman would then require what's called a radical hysterectomy. In terms of the uterus, the cervix, the ovaries, fallopian tubes, and lymph node tissue would need to be removed.
Okay.
Based on the analysis of that tissue, post-operatively, that woman would now require either radiation therapy and/or chemotherapy as well.
Okay. Again, expensive.
It is expensive. It is expensive.
Which is why prevention
Exactly.
is the key, ultimately.
Exactly.
But now, because it is so high on the scale of killers, if you would, with cancer, if the treatment is there, why the high rate of deaths?
Many a times, those individuals that I'm seeing with cervical cancer or who present with cervical cancer currently have not had pap smears in either 5 or 10 years.
And so the lack of
Preventative
care.
health care is a major factor or influence in the development of cervical cancer.
As a society, as healthcare providers, not just in Antigua and Barbuda, I guess we should actually take this globally then. Do we feel that there's enough being done to raise the awareness, to let people know, or our women in particular know what needs to be done to help prevent this?
Not enough has been done, and I think the number one tool that we have to tackle this is education. Once you have an educated population, we'll also have a healthier population. In addition to that, there are also several benefits. The healthcare costs would be significantly reduced if we can prevent the illness as opposed to treating the illness once it has been detected.
We were having a discussion some time ago on the program about HIV/AIDS and, excuse me, its prevalence. Do you find topics associated with sex, sexuality? Now, mind you, it's something that people enjoy and it's prevalent.
Yeah.
But when it comes to actually having the dialogue about sex preventing diseases, do you find that people are still hesitant about talking about these things? Oh, it's private. It's not something to be discussed in the public.
People are hesitant, but I think we're moving forward away from that. It's no longer discussed in closed doors. It's now moving into the public arena because we're all impacted.
Exactly.
By the decisions individuals make. If you have a woman in her late, early 50s who is now diagnosed with cervical cancer, you're not looking not only on the effect on that individual, but also on the effect on her family.
Exactly.
The effect on her workplace, the effect on our society as a whole. So we all have a role to play with that.
As it pertains, and you say education, and because it can be contracted by sexual intercourse,
That's
specifically the HPV virus, it needs to be included in the sex education
Most definitely.
classes and topics
Most
as well.
definitely.
Dr. Winter, I'm sure this is a topic that we can discuss more and more. And for that reason, I'd like to leave that seat open again for you one day so you
Most
can
certainly.
come back and either continue this discussion or other discussions,
Thank you.
that will come up. We thank you for being with us. And again, this won't be your last time. I'm almost positive of that. Again, we're talking about women's health. After the break, we'll give you a little bit more information about the event itself, what some of the things to be addressed, and we look forward to seeing you. So stay with us. We'll be right back. While cardiovascular disease is at the top of the list of causes of death here in our Twin Island nation, cancer, it's in a close second place. Two types of cancers we spoke of this evening, cervical cancer and breast cancer, are forms that can and should be detected early. This is done by having the routine screenings, the pap smears, and the mammograms as recommended by your healthcare provider. For the next few weeks, we will have a series of episodes focusing specifically on women's health. We hope that you will join us. Our wives, mothers, grandmothers, sisters, daughters, cousins, you are our world. Please take care of yourselves. We thank you for spending some time with us and for allowing us to share healthy perspectives with you. Be well, Antigua and Barbuda. May your perspective always be a healthy one.